So my name is Claude Nogard. I'm CEO and co-founder of Ergosuture. Next to me is Luis Almodovar, a neurosurgeon, lefty by birth, and inventor of the roller-based suturing system. Ergosuture is before and foremost a surgeon company. We have raised $8.5 million to date, 80% coming from surgeons. More importantly, over the past 2 years, we have been bombarded by surgeons from all around the world requesting access to our product for collaboration. We currently have 70 distributors requesting commercialization, and some of them have already signed letter of intent to get the product. So who are we? We are experts in suturing. And interestingly, suturing is very hard. Over the past 50 years, many products have been developed to improve suturing. Unfortunately, none of them are as versatile and efficient as suturing. So our objective is very simple. We are reinventing the suturing process to make it easier and more efficient. In the process, we have onboarded a tremendous amount of experts, people that have commercialized product for the past 30 years. And last year, we onboarded Mark Schutent and Waveframe, who have been involved in the process of commercializing product. So what did we do last year? Very simple. 2023 was show, demo, test, repeat. We went outside the US. We presented the product to more than 500 surgeons. We exhibited at five conferences, alone or with partners. We also did our first study that I will share with you. And what did we show them? We introduced this, the roller-based suturing technology, the first ever evolution of the suturing process in more than a century. And so what it is, roller-based suturing allows you to self-write, position, and drive a needle without ever twerking your wrist. Okay, thank you. Without ever twerking your wrist or using a grasper. And so let me show you what you do with an expert using the device.
I'm a right-handed surgeon.
Using your left hand.
Go and grab it. I'm gonna go forward just to show the motion. Going forward. Now I'm going back. Visible tip. I'm going to go into this thing. I'm not even correcting for the angle. I'm just going to get the depth. It's going to pop out there, release, and then go in and grab. Finish it out. Perfect, smooth, coming through, beautiful.
So you heard correctly. Dr. Chet is a righty. And he tried the device with his left hand. The reason why we showed you that video is to share with you how easy it is to use the device. Actually, we use that when we meet with surgeons and have a very strong muscle memory to help them to understand that there is no need to twerk your wrist. So what we have done, after reinventing the process, we made sure that our handle will be very consistent with what surgeons are familiar with. As you know, surgeons are very adverse to this change. So this basic handle here is very simple. It has two more commands. One to actuate the rollers, one to change direction of the needle. So very simple to understand, very intuitive. And so you might not believe that, but I will show you right now the data behind it. So that's why I'm very excited. So we have never shown that to anybody. So this is the first data for you. So we ran the test and wanted to validate our technology across 3 parameters: time, motion, and forces. Why forces? Because we use rollers. And wanted to make sure that there was safety to tissue. So the first test that you see here, we ask a surgeon to run 5 sutures. So very simple. In orange is our product. So you will see that it's faster, but the biggest part is how the force is applied to tissue. Never go above 4 Newton. That means simply that the device provides a suturing process that is consistent, repeatable, independent of the operator. So you might see it's 1 operator. So then you go to the next study. We took 10 operators, 10 surgeon resident first and second year. You ask them to do the same thing again. And as you can see, once again, the drive and roll outperformed the traditional needle driver over all parameters. Motion, forces, time. Easier, better, faster. And so you might want to understand how the device works. So I will show you in situ. So look at this. The needle will be self-righted, repositioned, and driven by the surgeon without ever twerking his wrist. Full control of the bite, ability to retract the needle at will, and basically catching the needle and pulling out the tissue without twerking the wrist. So using the arc motion, which is perfect. we have tried that device to work on all soft tissues, including the vaginal cuff. And you can see, once again, it's repeatable. No torque on the wrist. And this needle will go smoothly to tissue without damaging the tissue. So what are the unmet needs? Laparoscopic surgery, of course. Better suturing time, better learning curve. Actually, the learning curve is 5 minutes. And this is not a joke. This is literally 5 minutes. Application in robotic surgery for the learning curve, and I will give you more information about that. But also in terms of performance, because until to date, robots are not faster at suturing. And last but not least, is application in endoluminal surgery, both handheld and robotic. So interestingly, I believe that endoluminal surgery might be the most or the greatest application yet until we go into heart surgery, because they have no room to navigate and to manipulate tissue. The other challenge they have is deep in the lumen, you lack forces to drive them to tissues. So our market is about $5.5 billion, and I will share with you the first 3 segments. So we'll enter into laparoscopic, move into soft tissue for robotic and endoluminal surgery, and eventually we'll go into heart. So this is the first device, handheld device that has one handle that is reusable, can be sterilized, can be used for more than 200 surgeries, and you attach to it a single-use distillate. So it's a 510K device that we will launch in Q3 next year in the US, and Q4 next year in Europe. So initially for surgeries like general surgery, urology, and gynecology. We'll subsequently launch this device, electromechanical, to make it smaller so we can fit all hands, but also provide a smooth transition, but also some articulation. And the next round is going into robotics. So something we have done on top of adding the rollers is adding a cam system. And what that means, we can make out of a needle driver, a grasper, a dissector. We can force open and close the jaws. We can vary the clamping force, which basically allows us, especially in endoluminal surgery, not to have to change instruments. And so we are right now looking for collaboration because we are not a robotic company. We focus on suture. That's what we do. And so let me show you basically the reason why robotic is prime for that. This study was released last year by Dr. Haimi. And what they did here is trying to understand the learning curve between novices, intermediate surgeons, and experts. And you can see that between trial 1 and trial 6, they all improved. What you might want to pay attention in the forces for the surgeons, the novices also improved because of this visual haptic feedback learning. This is what you would have with a roller-based system. We actually consistently drive everything to the lowest. And the reason being is that the entire forces we applied are primarily based on the trigger pull, which is completely independent of the surgeon. And that's something that we are testing. Actually, we were preparing for the head-to-head, so we can actually come back next year to show you that. And so what are the benefits for our product? We own more than 8 patents in the portfolio. We have a razor-blade model. We have needles that we're developing to expand the reach. We have a cost-effectiveness model that we're building, which is unmatched. And we can use that platform across the board, from handheld, laparoscopic, to robotic. So we are currently closing on a $15 million convertible note, but next year we'll come to get an additional $10 million to get us to break even. So as you can see here, we will launch fairly quickly in the US and outside the US. So we are launching not only in human health, but also animal health. We already have pre-orders, so we're getting ready for that and moving forward to that. So join the evolution, the next generation of needle drivers. Thank you.